I'll also like to invite Dr. J.S. Rajkumar, sir. If you could come online, and he'll be giving one of his keynote addresses before we start the session. So,
Hi, Dr. Shiba. Hi, Rajiv. This is Dr. Rajkumar here. I don't know if you guys can see me, but thanks to technology, all of us are. So I want to start by saying, from a Tamil point of view, apni shabai bhalo achin. Tukita, second and a. And to say also, very, very importantly, hamare ai onchale ostro pachare sarvasesta technology on the chain. And definitely next time I'm coming, Parera Bara, Abashai, second Takabo. So with these few words, I want to start by saying I'm very honored that Mr. Akram and Ayan Chakrabarti and Dr. Natish have invited me to be there. I'm sorry, I'm in the middle of a robotic conference here in Indonesia, and I'm talking to you from Bali. So we have spent the last 25 years in healthcare from 1997 at Lifeline Hospitals, balancing the cost versus delivery of private healthcare. And I'm happy to say that a lot of our patients are from North Bengal, from the Siliguri, Darjeeling area, and from Bangladesh. I also want to acknowledge, don't worry, Mr. Chiba, I'll finish well before 10 minutes. I can see those lines of creases of worry cross your forehead. I'm not a Maikasura, and I will finish in a few minutes. So we also very much relate to Bharati and Tagore. 2 days ago was our great Subramania Bharati's birthday. I would like to say a big hello to our judicial magistrate who is there, who's from Tamil Nadu. And to say that the schoolmaster who spoke before me was brilliant. It's true that, as Winston Churchill said, the battles of the Second World War were actually won on the playing fields of Eton and Cambridge. So coming back to our point, I would like to say that Lifeline Hospital is committed to two things. One is to bring in the latest of technology like robotics, high-end hepatobiliary surgery, renal and liver transplant at a very, very reasonable cost into this area. That was the first thing I want to tell you. Indeed, we made a very big effort to bring in even Sastaswati scheme and try to get it in, but for various reasons, that is under suspension. The second thing is the Policy Times Summit. I want to make a commitment publicly so that I can't go back on that to people like Mr. Akram and Ayan, and on behalf of Dr. Natesh and myself and the rest of the team, to say that we will continue to be the partners to the Policy Times Healthcare Summit. The third thing I want to say is that Siliguri has already reached a tertiary level. Like Dr. Malai Chakrabarti said, I first operated in Siliguri in 1995 as a young laparoscopic surgeon. And now you have grown with leaps and bounds. And now the time has come to convert it to a quaternary place where eventually renal and liver and pancreatic and lung and heart transplants are being done routinely in Siliguri, where the latest of robotic surgery. We have partnered with CMR Surgicals from Cambridge, UK, one of the latest and most versatile robots, and we hope to be able to bring it to this area. Finally, I've met a lot of Bengali postgraduates who are working in the UAE. I also work out of UAE, Oman, Qatar, Kuwait, etc. And I've seen a lot of our boys from Bengal there. I want to quote Tagore back to you youngsters and say, Tagore said, I searched for peace and traveled across the world, came back and found that peace was waiting for me in the dark and dusty corner of my own room in my easy chair. And I want to tell people that all the youngsters there, they need not go running after 2 or 3 lakhs or 3 or 4 lakhs to UAE and Saudi, etc. I want them to start coming back and working in Bengal and places like North Bengal. I want you to blaze your own paths for yourself. We first, as children, learned Subramania Bharati's translation of Eklo Chalo, Eklo Chalo, Eklo Chalo Re. We need not follow the path of submission. I want to finish by saying I know personally of many so-called big corporate hospitals and groups. They are about to go for public space, public limited, or they advertise themselves as great saviors. Many of them are of Indian origin, and they use our Tamil and Bengali and our UP and Maharashtra boys as cheap labor. of late, I'm being involved in many commissions with the central government, and I hope to play a major role. We have to prevent that unnecessary brain drain. I want the boys from Darjeeling and Siliguri and New Jalpaiguri in that area to stay there. We are very, very happy to participate in training centers. We are already participating in a hospital, a medical college in Shantiniketan. We are happy to bring in all our efforts and all our gathered common intelligent consciousness into Siliguri area, so that in the future, youngsters will not get trapped in the corporate hospital mires of the foreign countries. Once more, I want to thank everybody who has participated for the last 1 hour. I heard Dr. Malay Chakrabarti, I heard the headmaster, I heard Mr. Chimber briefly, and I heard the other person who was coordinating. Brilliant talks. I hope I know it's being recorded. This should be available to people all over the world. Once more, I would like to end with my commitment as a chairman of Lifeline Hospital and as a senior laparoscopic GI surgeon to bring in all I can to help you and to bring our institution there, so that all of us can work as one towards making Siliguri not just a feeding center for the Apollos or for the corporate institutions, but to make Siliguri completely self-reliant by itself, so that we can say, Ekla chalo, ekla chalo, ekla chalo re. Thank you all, and I hope to be there next time with all of you. Jai Hind.